Good morning, everyone. Sorry for the delay and wish all of you a very belated Happy Women's Day during this Women's Week. Of course, it's Women's Day all through the year, but of course, 8th of March is always special. And today I will be talking on the recent trends in management. You know, science has advanced to such a degree, especially in obstetrics and gynecology, so making life much easier for women. Now, all of us, this is the hospital I work. Now, all of us know that at various periods in a woman's life, be it adolescence, 10 to 20 years, the childbearing years, 20 to 40 years, then the pre and post menopausal years and the older women. At all these stages of life, there are different sets of problems. And with the recent advances, we have, most of these issues which are now currently there can be tackled. And let us take the problems of adolescence. Now, we all know that puberty is when one gets the first period. And we know that this generation, there is, the girls are getting their periods much earlier. In, the older generation or our generation, it was 12, 13, and now girls are getting their periods as early as 9. And this is because of better nutrition, better awareness, in these girls. But getting a period below the age of 9, like 7, 8, is definitely a precocious puberty and should be investigated. And then you have delayed puberty when the first period is after 16, 17, and that also has to be investigated. Now, all of us have had angry teenage girls at home, because this is the period of time the hormones kick in and there are behavioral problems, stress, depression. Every girl in that age group, because of peer pressure, wants to have a size 0 figure. They want to have a body image. They are, that's the time that they are depressed because they are not included in the group, or because of their body image, because of peer pressure, etc. And that leads to eating disorders like anorexia nervosa and bulimia. Now, in anorexia nervosa, and these are definite conditions which need treatment, is that a girl looks in the mirror and always thinks that she's fat, when in actual fact, she's very thin and she refuses to eat. And in bulimia is that she binge eats and then tickles her throat and vomits, like the famous Diana. And these eating disorders are very common in adolescents and have to be treated. Then, of course, obesity and PCOS, and I think that is the biggest problem that adolescents face today. In our days, we always had physical training and we had to have PT and hockey and pro ball, etc. Now, you see the young girls of today in schools, their curriculum is so vast. They sit at their desks all day. They have laptops. They have evening tuitions. There's no time to exercise. And because of that, they start having obesity. And because of obesity, that leads to polycystic ovarian syndrome, which I'll talk to you a little later. And of course, abnormal bleeding patterns, right up to 2 to 3 years after menarche or the first period. Then there are abnormal bleeding patterns like too much of bleeding or scanty bleeding. And one should just ignore that or just treat with hematinics until such time the periods will become normal, which usually happens. Now, the most, as I said, anorexia nervosa, not wanting to eat and vomiting out, etc. Those conditions have to be treated with a psychiatrist on board. Then we come to polycystic ovarian syndrome. What is it? Everyone is so frightened. The mothers take their daughters to the sonologist and they said, you have polycystic ovaries. And, there's so many fears that the girl won't conceive and that, etc., etc. It is a sin. See, there is a menstrual clock. Every month, one egg ripens, then it ruptures, and then the lining comes out in the form of the monthly period. And this is all governed by the higher centers called the pituitary ovarian axis. Now, when this hormone balance, the menstrual clock, is out of tune, you get polycystic ovarian syndrome, which is a hormone imbalance, which causes hirsutism, excessive hair on the face, menstrual irregularities, infertility, acne, obesity, and insulin resistance. So the scary part is that 1 out of every 3 adolescent girls and 1 out of every 5 women in their reproductive age have got polycystic ovarian syndrome. And as I already explained, because of the PCOS, you have acne, weight gain, depression, stress, high blood pressure, excessive facial body hair, irregular periods, no periods, hair thinning, and abnormal skin discoloration. Not great. So sorry for the interruption. There was a technical glitch. So as I was talking about the follicle, what happens with PCOS? So every month, one egg follicle forms among millions of eggs due to the hormones FSH, which is produced by the pituitary gland. And this FSH causes one egg every month to ripen. When it's ripening, it produces the hormone estrogen, which acts on the lining of the uterus and increases it. Then when mid-cycle, when the estrogen is of a certain level, LH is produced, and this luteinizing hormone then this luteinizing hormone causes the follicle to rupture. And as you can see, the right follicle comes to the surface of the ovary, it ruptures, and it's picked up by the fallopian tube. And only in the next 48 hours can pregnancy occur. Then what happens most cycles is if the pregnancy doesn't occur, the lining of the uterus comes out in the form of the monthly period and the egg shell dissolves. And therefore, this is what happens with the menstrual cycle. Now, in polycystic ovarian syndrome, there are abnormally high levels of luteinizing hormones. So every month where the egg ripens, but it remains immature and it doesn't rupture. So every month there is just an egg, unruptured egg, which starts accumulating inside the ovary, as you can see, to form multiple polycystic ovaries. Now these cysts, the stroma produces insulin resistance. So even though one is not diabetic, but there is insulin resistance, the body is not recognizing insulin, and so it's very hard to lose weight. Also, increased amounts of male hormones like testosterone are produced, and these high levels of testosterone then cause the acne, the abnormal hair growth in the body. And because of long-standing PCOS, there is a greater risk of type 2 diabetes, heart disease, dyslipidemia, high blood pressure, and also increased chances of having a cancer. I spoke to you about the stressful lifestyle. It's all because of stress. There's inadequate sleep, there's lack of physical activity, insulin resistance, hormone imbalance, PCOS, and infertility. So this is the vicious cycle of PCOS. You have insulin resistance, which makes it difficult to lose weight. There's increase, therefore, in weight, and that increases the PCOS and infertility as well. And because of that, we know that PCOS is not a disease, but it's just a metabolic disorder where you have insulin resistance, you have infertility, increased chances of malignancies, high blood pressure, central obesity, etc. And therefore, the goals of therapy for polycystic ovaries should be restore ovulation, ensure that that egg is released every month, and therefore the male hormones or the testosterone levels will reduce. Then there should be weight loss to decrease the risk of long-term mortality. So, and prevention of endometrial cancer. So therefore, the mainstay of therapy for polycystic ovaries is exercise, diet, lifestyle change, nutrition, and drugs to restore ovulation, and maybe, reduce the male hormones. So therefore, weight loss, as I said, is the key. Hair removal can be done with laser, etc. Oral contraceptives to stop ovulation, gonadotrophins, anti-male hormones, insulin sensitizers, and for those who have polycystic ovaries and are infertile, we do laparoscopic ovarian drilling. Now we'll come to the next part, next phase in a woman's life, the childbearing years. And I've picked up a few problems which are very commonly faced by most women. And for, many women come into my consulting room, almost 60% with vaginal discharge, urinary incontinence, urinary tract infections, and sexually transmitted disease. Now, everyone has a vaginal discharge. It's quite normal. There are wet days, dry days, and all women do have a discharge continuously. But when is a vaginal discharge abnormal? It's when there's a foul odor, a malodorous discharge, which could be bacterial vaginosis, a curdy discharge like curd with intense itching, irritation, which could be fungal infection, a green, yellow-gray frothy discharge could be trichomoniasis, and a yellow discharge with no symptoms could be a sexually transmitted disease like gonorrhea and chlamydia. Therefore, any abnormal discharge, you must go to your gynecologist, have it checked out, and give the appropriate treatment. And especially in Mumbai, you have a lot of fungal infections, and that is because the weather is so moist. One should not wear, so little things like not wearing a nylon underwear, wearing only cotton clothes, loose clothes. Jeans are a girl's worst enemy because there's always recurrent fungal infections. And of course, good hygiene. So the next is urinary incontinence. Now, this is around the age of menopause. Almost 1 out of every 5 women have urinary incontinence. Then there's urge incontinence, that by, in recess urinary incontinence, when coughing, sneezing, etc., urine comes out. It's so embarrassing. In urgency incontinence, by the time you reach the toilet, the urine has come out. And mixed incontinence. With urinary stress incontinence, as I said, as you grow older, because of waning estrogen hormones, the tissues become lax and the bladder wall descends, the angulation goes. Therefore, any increase in intra-abdominal pressure, like coughing, sneezing, even laughing, even carrying weights or doing your exercise, and there's an embarrassing leak. Many women suffer in silence, wear a pad, and then their social life becomes, they can't travel, they can't go out anywhere because of this leakage. And then for them, there is a very good pelvic floor muscle training or exercises, which are Kegels exercises. So you can just Google and do the Kegels exercises. And almost 50% of stress incontinence can be treated with the Kegels exercises. For those who don't, and they have a poor quality of life and they have to live with pads, then there is a simple procedure where we call a transvaginal tape, where we just put this tape transvaginally, and that lifts up the bladder neck, and there's continence. It's so wonderful. So many of my patients have blessed me for this minor surgery. The tape becomes part of the body, and for the rest of their life, they are continent and have a better quality of life. Then, of course, you have urinary tract infections. Cystitis. It starts with, the urinary passage for women is very short. And also there is the vagina and the rectum full of bacteria very close by. So cystitis usually starts with the honeymoon. So we call it honeymoon cystitis, where because of frequent intercourse, there is an ascending infection from the vagina into the bladder, usually E. coli, resulting in increased frequency, burning, pain while passing urine. Now, whenever that happens, you have to immediately see your doctor, do a urine examination, do a urine culture and antibiotic sensitivity, because you must know what bacteria is causing the infection and to what antibiotic it is sensitive to, so that a complete treatment can be given. If not treated properly, you have recurrent UTI, and what is even worse, the infection may ascend through the ureters into the kidney, and you have what is known as pyelonephritis, which is a very frightening condition and difficult to treat. And therefore, I always feel urinary tract infections are so common, especially among working women, because they don't have access to clean toilets. So they tend to drink less water. You must have at least 6 to 8 glasses of water a day, void frequently, and also ensure that the clothing is loose and cotton only. And when washing, you must always wash from front to back and not back to front, because in the rectum, the E. coli bacteria, which is the commonest bacteria which cause cystitis. Then we'll go to menstruation. I've already told you what menstruation is. It's the shedding of the lining of the uterus every month. So what are the problems? Premenstrual syndrome, you know that almost 90% of women have premenstrual syndrome. And it's because of the hormonal change just before the periods come, where you feel all bloated, irritable, mood swings. You know, this is a difficult phase in life. In fact, we had done a survey in the female prisoners and found that most of their crimes were committed during their premenstrual syndrome phase. And, during their premenstrual phase. And I'm sure everyone who's worked either at home or in office has always faced some snide comments from colleagues. Oh, she's irritable, must be premenstrual syndrome, So with premenstrual syndrome can always be treated with alkaline foods and also positive attitude, good physical activity, avoiding acid, substances which increase the acid in the body. So, and also some girls have such severe premenstrual syndrome, we call it PMDD, which requires treatment. Then menstrual cramps is again so common among women. In fact, the government is now, I think you must have read, deciding to give menstrual leave to women in all institutions, which we really welcome, because even though 70% of women do have menstrual cramp, 10% of women have such severe cramps that they can't go to work and they have to take leave for 2 to 3 days every month. Now, menstrual cramps are because the uterus has to contract to push out the lining, and therefore just a hot water bag, for most women, a hot water bag or a antiprostaglandin, antispasmodic will help. But for those who have very severe cramps, then in that case, we have to investigate, because it could be that actually she has something called endometriosis, where she's bleeding internally as well, or fibroids or cysts, etc. And then, of course, you have abnormal bleeding. Now, in abnormal bleeding, there could be amenorrhea or no period at all, right from birth, right from adolescence, no periods. In that we have to investigate. Or some girls who get their periods and then the periods stop. Menorrhagia is too much bleeding, hypomenorrhea, too little bleeding, irregular bleeding, intermenstrual bleeding, and bleeding after intercourse. Now, bleeding after intercourse is very ominous, because very often that's the first sign of a cervical cancer. So therefore, one has to diagnose why there's extra bleeding by doing a transvaginal ultrasound. Transvaginal ultrasound is the norm today, because with color Doppler, with a good transvaginal ultrasound, you can diagnose polyps, growths, thickened endometrium, precancerous conditions, and cysts in the ovaries, etc. And therefore, an endometrial biopsy if the lining is thickened, and a hysteroscopy where we do put in a small telescope, it's minimally invasive, and take out the lining of the uterus or even treat the conditions. So once we have diagnosed that there's heavy menstrual bleeding because of dysfunctional uterine bleeding, so what are the options? The heavy bleeding is because the lining is too much. So we have to give hormones to control the lining. And what is wonderful is today the Mirena insertion. Mirena is a coil in which there is a hormone which is embedded in it, and every day 65 micrograms of progesterone is released into the lining of the uterus, and therefore thins down the lining of the uterus without causing major side effects. And this Mirena has saved so many patients from a hysterectomy. So if you're perimenopausal, suppose you have very heavy menstrual bleeding at the age of 38, you can't keep on taking hormones till the age of 50 at menopause, so that 20 years you can't take hormones, and it's not required to remove the uterus. So with a Mirena, you put it in for 5 years, then take it out, put another Mirena. It's also contraceptive, by the way, and it will reduce the amount of bleeding. And then if there is the heavy lining is the cause, then endometrial ablation can be done either with a thermal balloon or with transcervical resection or microwave. So this is the treatment for menorrhagia. And of course, if in spite of all the treatment, if there are large fibroids, etc., then the uterus can be removed through minimal access surgery or laparoscopic keyhole surgery, where, as you can see, a small punctures are made through the navel and 2 side punctures. And with the help of sealing devices, the entire uterus can be removed either in a bag from above or from below, and the patient can go home the next day. So minimal access surgery with 3D laparoscopy and robotic surgery has revolutionized treatment of women today. And no longer do they have large incisions, staying in hospital for a long time, can't go back to work, complications of hernia, etc. All that is the thing of the past today. because with greater advances in minimal access surgery, through small keyholes, we can do minimal invasive surgery, and even large fibroids. I've removed even 3 kilos, 4 kilos, 8 kilos can be done through the laparoscope. The patient stays in the hospital only for 1 day and can go home. In fact, when I do this, and the greatest part is that it's painless because we use harmonic of sound waves for vessel sealing. So there's no crushing of the tissues, there's no sutures, etc. So these patients don't have pain. In fact, when I go for my rounds in the evening, the patient says, "Have you really done my hysterectomy? I have no pain." It's such a wonderful thing to hear. And then you have endometriosis. This is very common today because most girls are either getting married late or they're delaying their childbearing, and then they have this condition endometriosis, where every month, the lining of the uterus comes out through the vagina. But for some unfortunate girls, it goes backwards through the fallopian tubes and falls on the ovaries and behind the uterus on the rectum, etc. And every month the lining starts growing there. So when you bleed outside, you're bleeding internally as well to form this chocolate cysts. As you can see through laparoscope, just like molten chocolate. I'm sure most of you all will not want to eat chocolate again after seeing this video, but this is exactly what happens, that all the inspissated blood it gets accumulated, and the adhesions form, that the scar tissues form, the tubes get blocked, the intestines get stuck, and there's painful period, painful intercourse. So what do we do with endometriosis? Young girls who don't want child, it all depends on young age, with a desire for childbearing, size and site, and severity of the endometriosis. So in young girls who have endometriosis, we can give low dose progesterone in the form of Dynogest. If the patient wants to have a baby and you have large chocolate cyst like this, then a laparoscopic clearance, removal of the cyst, and removal of all the endometriotic deposits are done, and the patient can conceive, because the treatment actually for endometriosis is to get pregnant. But the catch-22 situation is, because of endometriosis, the tubes are blocked and the girl can't get pregnant and has to resort to assisted reproductive technology. So this is endometriosis. And then another condition is adenomyosis, where the lining of the uterus is present in the wall of the uterus, in the muscle of the uterus. So every month there's very painful bleeding into the wall of the uterus becomes very bulky, and even after the period goes, there's still a lot of pain in the lower abdomen. Unfortunately, the only treatment for adenomyosis is a laparoscopic removal of the uterus. And of course, uterine fibroids. Again, as I told you, delaying childbearing, few children in this generation, almost 1 out of every 3 girls have fibroids. Now, all fibroids do not need to be treated. The only time we would treat uterine fibroids are if they are inside the cavity of the uterus, preventing conception, if there are multiple large fibroids causing very heavy menstrual bleeding, or if there are pressure effects on the neighboring organ, like pressure on the bladder, so inability to control urine, or pressure behind where there's back pressure on the kidneys and hydronephrosis, or swollen kidneys. Some girls even go into kidney failure, and then we realize it's because of large multiple fibroids. In those cases, then fibroids should be treated. Now you have non-surgical methods of treatment for fibroids by giving gonadotrophin injections and producing a sort of semi-menopause for some time so that the fibroids shrink. Then there's uterine artery embolization, where through the femoral vein, we put in a catheter, go to the uterine artery and put small little substances over there to block the uterine artery so that the fibroid doesn't get blood supply and shrinks. And then you have MRI guided focused ultrasound, where you use the MRI to focus on the fibroid and then focus the beam of the ultrasound on the fibroid, and that helps to shrink the fibroid. But unfortunately, all these non-surgical methods are only temporary. For large symptomatic fibroids, they will last for about for the duration of the treatment, and then after that, within 6 months, they are back with a vengeance. So therefore, surgery, very often, surgical option is important. So here you can see, through minimal access surgery, a large fibroid, just like in open surgery, can be done beautifully with minimal. This is using of harmonic scalpel, and the fibroid is then lifted out of the uterus. You can remove multiple fibroids also. I've removed 44 fibroids, 64 fibroids also, and then suture the uterus back in place, just like you would do in open surgery. Then these fibroids are then put into a bag and morcellated out. So this is the charm of in minimal access surgery today. No woman requires to have an open surgery. Then we come to, how much time do we have? Yeah. Then we come to the next important, which I feel almost 50% of girls today, infertility or subfertility. And you, in order to conceive, you need that the uterus should be normal. There should be no polyps, growths of fibroids. Both the fallopian tubes should be open and an egg should be produced every month. And for the men, the sperm should be of adequate quantity, quality, and motility. Now, everyone is delaying their childbearing, and we know that women have a very short biological lifespan. So the ideal age of childbearing is 18 to 25. If you have your babies during that age, you will never age. But who's getting married at 25? Everyone's getting married at 28, 29, 30, and that they don't want to have a baby so soon because they are at the peak of their career. They want to extend to 36, 37, and then infertility happens. And very often couples don't have time to have intercourse. They have only intercourse on the weekends. And you know, there's only 48 hours in the whole month in which you can conceive. And if ovulation is not on the weekends, then months will pass before the girl can conceive. So therefore, we have to see what is the factor, treat the factor, and many times there's unexplained infertility. So for infertility, finally, the greatest advances in this decade has been in assisted reproductive technology, where every woman can have a baby, and even if there's one sperm, the woman can have a baby because of assisted reproductive technology. So if the sperm motility is not good or the counts are less, you can do an intrauterine insemination. That is, the husband's sperm is collected on the date of ovulation. It is centrifuged. The best of the sperms are then put inside the uterus, near the fundus of the uterus, and the chances of conception go from 20 up to 20%. Then if the tubes are blocked or if there's unexplained infertility, then there's in vitro fertilization. That is, since the egg can't meet the sperm, multiple injections are given to produce multiple eggs in the cycle. Those are removed when they are ripe and ready through the vagina, through ultrasound. And these eggs are then mixed with sperms, embryos are formed. And then when the embryo is in the blastocyst or, multiple eggs stage, then that embryo is put back inside the uterus and the girl gets pregnant. So IVF is almost 60 to 70% successful today given the recent advances. And of course, if the sperms are very low in quality and they cannot penetrate the egg by themselves, then you have through laser intracytoplasmic sperm injection, where ICSI, where you actually inject the sperm inside the egg to form an embryo. And there are very lots of equipment now available to which will actually look at each embryo and find out whether they are good embryos or not, and grade the embryos. And then, of course, if you have, we have egg donation. So an elderly woman who, as I said, age, by the time you're 40, then the eggs are very low and low in quality, and they're not capable of being fertilized. So an elderly woman or woman who's, doesn't have ovaries, if she has had radiation and there are no eggs, then she can have an egg donation. That is, a younger woman donates her egg. So donor egg, husband sperm forms an embryo inside your uterus. That is egg donation. And then if there are no eggs, you cannot produce eggs, husband has no sperms, then you have an embryo entirely from a different person put inside your uterus. And then, of course, if one cannot have a baby due to congenital malformations of the uterus, due to medical conditions like maybe a renal transplant, or if you have a heart disease or severe diabetes, in those cases you cannot carry a baby to term, then your egg, your husband's sperm, your embryo is put into a surrogate mother. Unfortunately, today surrogacy has been banned. There are very stringent rules now. So surrogacy in India till now is totally banned. Only those who are related or who have altruistic, that means no money exchanges hands, only they can have access to surrogacy. And then you have pre-implantation genetic diagnosis, as I told you. Once the embryo is formed, a little bit of the embryo is taken and genetic testing is done to see that the person does not inherit genetic traits. And of course, the most important, egg freezing. Even today in the papers, Bombay Times, I saw there was an article on some actress who has frozen her eggs. And I see it all the time in my clinic. Everyone, most working girls come for egg freezing. What is egg freezing? You see, as I said, we have a short biological lifespan. So basically, after the age of 35, the eggs quality goes down. By the time you're 38, 39, ovulation is very unusual. And by the time you're 40, those eggs are not capable of being fertilized at all. And there's a test called anti-Mullerian hormone, or AMH, which is done, which actually tests your reserves. So when you're young, like 28, 29, if the AMH is good and you want to postpone childbearing, then there is a possibility of egg freezing. That is, multiple injections are given during the cycle, first few days of the cycle. To every month, only one egg ripens. But here we ripen many eggs, like 10 to 14 on either side. And then through ultrasound guided, the eggs are retrieved outside and then they are frozen. And if you're married, then embryos can be frozen. This can be used at a later stage when you are ready to have a baby. So much for all the advances that we have in recent years in assisted reproductive technology. And of course, there's uterine transplant also. And then we come to a stage that no one wants to know about also, and that is menopause. But believe me, menopause is a time for new developments, greater freedom, and everyone should embrace menopause. But most people are worried about being itchy, bitchy, sweaty, sleepy, all dried up, forgetful, and bloated. And all these symptoms are actually due to estrogen deficiency. You know, we women have estrogen receptors right from the head to the toe. There are estrogen receptors for the skin, the heart, the bones, the vagina, the uterus, the breast, everything. And what happens with all the symptoms is because of estrogen becoming less and less and less. And therefore, we have all the symptoms of menopause. So you have the pre-menopause, that's the few years before menopause, then 2-3 years before the periods actually stop, and 2-3 years after the periods stop is perimenopause, and after 2 years, it is post-menopause. Now, the age of menopause in Indian women is between 45 to 55 years. And all the symptoms are because of estrogen deficiency. So you have hot flushes, night sweats, palpitations, the tissues become very thin, the vagina becomes dry, thin, there's a painful intercourse, frequent vaginal infections, postmenopausal bleeding, and urinary dysfunction like stress incontinence, urgency, frequent urinary tract infections. One intercourse because of dryness, and then the next day you get postcoital urinary infection. Then psychological problems like, depression, loss of concentration, irritability, poor libido, insomnia. And, most of my girls who are working, women, they say, at the age of 45, 50, when we are at the prime of our career, we are felled by menopause. So earlier we used to give hormone replacement therapy. But now so many studies have shown that long-term hormone replacement therapy we can't give because the side effects quite outweigh the benefits. So we give now, definitely better molecules are now available, better estrogens, better progesterones for hormone replacement. So if there is estrogen deficiency, then if a woman is really symptomatic, can't live her day-to-day life because of hot flushes, because of all these problems, if the vagina is so dry, they keep getting infection, if they have recurrent urinary tract infections, yes, we can give hormone replacement therapy. It can be given for the smallest possible dose for the shortest possible period and always under medical supervision. There are also the most important, what I would say in life is lifestyle change. So Start being more active, do physical fitness, weight-bearing exercises to strengthen the bone, change the diet, and have a completely new lifestyle, and you'll be able to sail through menopause. And this is the time, you have to have separate bedrooms. And the long-term effects are, of course, after menopause, we are protected by our estrogen. But after menopause, we have the same incidence as men to have cardiovascular disease and atherosclerosis. And of course, osteoporosis, which comes like a thief in the night. Every woman will lose at least 30% of her skeleton in the first 5 years after menopause, which is so important to take calcium supplementation at that time. Because the estrogen hormone is responsible for absorption of calcium, deposition of calcium in the bones, and prevention of resorption. So what happens in menopause? Less calcium is absorbed, less is deposited, more is taken out of the bones. So the bones become brittle. Your skeleton becomes shorter. Even one fall and the wrist fractures. One sitting in a rickshaw also, the back will fracture. So osteoporosis is a problem, and one has to treat that. Now we'll come to early detection of cancer. We know that cancer of the breast is the leading cancer in Mumbai today in urban cities, and followed then by cervical cancer, uterine cancer, and ovarian cancer. Now, breast cancer is we are seeing even in younger girls. The warning signs are a lump in the breast, discharge from the nipple, changes in the shape or position of nipples. The risk factors are actually, I would say, family history of breast cancer and long-term estrogen. Like if there's early onset of first menstruation and late menopause, there are many more years with estrogen, and that triggers of cancer in women. First child after 35, not having breastfed your child, childlessness, and a diet high in animal fat and low in fiber. So how do we screen for breast cancer? Every girl should have, after the age of 20 to the age of 40, self-examination of breast after the period is over, and once in a year examination by the physician. After the age of 40, you should have either an ultrasound or a mammography every year. If there is a family history, then it should be every year. And after the age of, that is between, after the age of 40, at least a mammograph. If not every year, then every 2 years. And the way to do self-examination, of course, you can read up. I won't dwell on that. There are many videos which teaches you. But when you do a self-examination, what do you look out for? Any new lump or hard lump found in the breast or armpit, any lump or thickening of the tissue that does not shrink or lessen after the period, any change in the size, shape, or symmetry of the breast, any dimpling, puckering of the nipples, withdrawing of the nipples, redness and scaliness of the nipples, discharge from the nipple, tenderness, nipple retraction, any change in the breast which you feel is not there, which was not there before, you must have an examination done. And fortunately, the recent advances in imaging techniques and also treatment for breast cancer has actually really advanced. So you have very good mammography, digital mammography, ultrasound, CT scans, MRIs, nuclear medicine, breast imaging, PET scans, ultrasound guided breast biopsies, and breast mass evaluation. And even in the treatment, no longer the breast has to be removed. You can just manage with a lumpectomy, or the lymph nodes need not be removed. We have a sentinel node which can be first removed and seen. So there are lots of advances. Also, if the breast has to be removed, you have mammoplasty at the same time. So no girl will lose her breast on the table. She has her breast cancer removed and at the same time has a new breast put on, and that is mammoplasty. And then we go to cervical cancer, which is the second largest cause for cancer in India today. The signs are intermenstrual bleeding between two periods, bleeding after intercourse, prolonged heavy bleeding, or postmenopausal bleeding, usually seen in rural areas. The risk factors are sexual intercourse at an early age, multiple sex partners, and many children, and poor hygiene. We now know that 98% of cervical cancers are due to human papilloma virus, HPV, which is a sexually transmitted disease. Though there are hundreds and hundreds of HPV viruses, there are only 4 or 5 which are high risk for cancer. 16, 18, and some of the types of that. So therefore, screening is so important. Every girl must have a pap smear. The pap smear detects abnormal cells even 10 years before cancer can begin. And human papilloma virus, if there's a high risk HPV, then the girl has to be treated. So therefore, every year, a pap smear, every 5 years, an HPV testing should be done. And if once there is HPV positive, then we can do a colposcopy, we can do colposcopic directed biopsies, we can do conization. You need not remove the uterus, only that area can be removed. And there are lots of advances in treatment of cervical cancer as well. Uterine cancers for older women who have irregular, heavy and postmenopausal bleeding. Obesity, diabetes, infertility, and overexposure to estrogen are the cause. The screening is, of course, doing a biopsy. So if one has to have a cancer, that's best uterine cancer, because they are always completely treated when detected early. So at the end of my talk, I would like to invite all of you to give yourselves a birthday gift on your birthday and go for an annual checkup, because it is always better to take care of your health, and then you can relax for the next year after knowing that everything is okay with all your organs, especially after the age of 40. Hemogram for anemia. You know, anemia is the most common condition in India today. Tests for diabetes, which comes on with maturity onset, liver disease, where you have fatty liver, non-alcoholic fatty liver, heart disease, kidney disease, urine, and all the routine tests. Then thyroid function tests, because very often women become hypothyroid around the age of menopause. Tumor markers like CA125, pap smears, etc. X-ray chest, ECG, ultrasound for the liver, gallbladder disease. You see a fat female 40, that's the time you get gallbladder disease. And pelvis for ovarian tumors, uterus, fibroids, etc. Mammography for the breast, sonomammography. DEXA bone densitometry is for osteoporosis, stress test, 2D echo, etc. These are all the tests and the consultations that you should have once a year. And therefore, you should not be like an ostrich with your head in the sand. What I don't see, I don't know, will not affect me. No, you must be wise like an owl and say, I will get my tests done, and I'll be confident that if nothing is wrong, I can get on with my life. And so you must always remember, dear women, that a woman's wealth is a woman's health. And we won't be able to be caregivers to our parents, husbands, children, and everyone like we normally do if we don't have our own health. So please look after your health, and I would be very, very happy to answer any questions if there are. Thank you.